In today's nursing mindset, I want to talk about something that seems incredibly simple: feeding a patient. Now, most people think feeding a patient means bringing them a meal tray and simply helping them eat. But nurses know it's much more than that. In fact, one meal can tell you a tremendous amount about your patient. Let me give you an example. Imagine we have two nursing students walk into the same patient's room. The first nursing student says, "Here's your lunch. Let me help you eat." The second nursing student pauses before touching the tray and starts asking some questions. Is this the correct diet? Can my patient swallow safely? Are they alert enough to eat? Can they feed themselves? Do they need help opening containers? Or do they need me to feed them completely? Same patient, same meal, completely different nursing mindsets. The difference is that nurses don't just see food. We see an opportunity to assess. Now imagine something else. Your patient takes the first sip of water and he immediately starts coughing. Now a new student might think, maybe they just swallowed wrong. A nurse starts thinking much differently. Could this patient have dysphagia? Am I seeing signs of aspiration? Should I continue feeding them? One simple observation can completely change the patient's plan of care. Sometimes the safest thing that you can do isn't continue feeding. It's stopping the meal, keeping the patient safe, and notifying the healthcare team so the patient can receive a proper swallowing evaluation. That's clinical judgment. Now let's think about what happens while the patient is eating. Are they becoming tired? Are they pocketing food in their cheek? Can they use their utensils independently? Do they need adaptive equipment? How much assistance do they actually require? Now notice that none of these questions have anything to do with whether the patient likes mashed potatoes or chicken. They're nursing assessments. Even after the meal is over, your job isn't finished. One of the biggest mistakes nursing students make is documenting what was served instead of what the patient actually consumed. Imagine documenting that your patient ate lunch when they really only managed 3 bites and a few sips of water. That inaccurate documentation could lead the healthcare team to believe the patient's nutritional needs are being met when they really aren't. Accurate documentation helps providers, dietitians, and nurses recognize when nutrition plans need to change. So by the time you finish one meal, you've done much more than help someone eat. You've assessed swallowing. You've recognized signs of possible malnutrition, evaluated independence, observed for aspiration, measured intake, provided education, and documented your findings. You didn't just feed a patient, you completed a focused nursing assessment. As you prepare for lab, use the graphic as a quick reference. It highlights the key reminders you'll apply during our activities, from recognizing signs of malnutrition and promoting safe feeding to documenting intake accurately. But remember, the graphic isn't the nursing mindset. The nursing mindset is learning to see everything that's happening beyond the meal tray. Every meal is an opportunity to assess, protect, educate, and promote healing. That's the nursing mindset. Keep developing yours.